Thank you, Nava, and thank you and your team for helping us do this difficult work in Zambia. It says in the program that I'm a practitioner. I'm a retired medical practitioner. I'm a media practitioner, which I was before I became a doctor, still in the media. And now I'm practicing, so I'm a marketing practitioner. And I work with PSI in Zambia, an organization for society for family health, and as Nava said, our work is to use private sector methods to market. Initially it was health products. And for many years we marketed condoms, we marketed oral contraceptives, mosquito nets and things like that. But now, increasingly, and especially in Zambia, we're finding ourselves questioning permission, no margin, no mission. Because we're finding ourselves having to help our government to implement health services. For example, we are very heavily involved in providing male circumcision, which is free. There is no margin in there, not for us, because it is a government service, it is a government program to provide male circumcision to help reduce the risk of HIV. We're also involved in reproductive health. We are putting in loops, IUCDs. We are inserting implants for long-term family planning. We're also involved, and this is cutting edge stuff, where we are actually putting in the loop within 48 hours of a woman delivering. We're doing this in government services, using government commodity, but we pay the staff, our staff. So in there is no margin for us. So while we're in a private sector methods-driven organization, that mission is beginning to change. So just a few words about this particular product and why we asked our colleagues to come and help us with it. We had female condoms in Zambia from 1998. And it's a very difficult product to promote. We tried heavy radio, TV, newspapers, heavy presence, but it just didn't move. And I think this is the experience in many African countries. So by the time that this work was starting, it had been there, kind of in the back really, and we continued to push male condoms, private sector methods. I was saying to somebody earlier today, or was it last night, that Zambia is probably the only country in the world where if you come and visit us, you will see adverts on TV that says, "Be a man who cares, have MC, have a male circumcision." So we're using these methods, these heavy advertising methods, to push health and health products. So with a female condom, we found out that our neighbors in Zimbabwe were selling in a year, in a month rather, what we were selling in a year. That was like 200 pieces or 200,000 condoms in a month. And for us, we struggled to get 200,000 condoms out in a year. So that is when we say to our colleagues, come sit down with us. Let's just look at how we can get this product to move. Let's find innovative ways, new channels of getting this product to move. And in the 4 categories that Nava described, even before I joined this organization, I became the part of the prize for status incentives. So the people who sold most condoms, but for no profit, for whom the prize would be to have a ceremony where they would come and meet with me, with their families, and shake a hand, maybe have a photo opportunity and things like that. So it was not my design. It was something that happened before I joined the organization. So what have we learned? And as Nava said, the results are still being cleaned up, but we see very exciting possibilities with this. Because we work in 4 health areas. We work in HIV, I've told you about male circumcision, male condoms, and also we do counseling and testing, and we do the female condom as well. We also work in malaria, distributing meds, working in reproductive health, and we also work with a product, a point-of-use water purification product. And we see the possibilities of the things that we're learning from this experiment in all our products. that maybe we really shouldn't be thinking too much that because we have to use private sector methods, therefore there must always be a margin in there for somebody, for the distributor, even for us as an organization and so on. So we are very, very excited that this is going to show us the way for the future. Because although we are a private sector driven organization, we are working in Zambia, as my colleague said, the real Africa with real African poverty, with real African problems. So how do we ask people to pay even a small amount of money for a product? We heard earlier how the price of a beer was equal to 100 worm tablets. But sometimes the price of a condom is equal to a little bit of cooking oil for the meal tonight. So there is a lot of conscious debate within the organization that is the use of private sector methods, profit-driven methods, really the way to go in health for Africa, especially for poor countries like Zambia. What else have we learned? We know that particularly with the female condom, it is not a product that you talk to a woman for 5 minutes and she buys the idea and she goes home and uses it. And this relationship that we are buying into, the relationship between the hairdresser and the client, women, I'm sure you all do, ladies, go back to the same hairdresser all the time. You create a long-standing relationship. You create trust. And if she has a product that she's been trained to talk to you about, you're very likely to listen. If you have questions, you're very likely to go back. Our health workers, the few that we have, do not have that kind of time with our clients. We know it's a long way to go yet. We still have to have the results disseminated, and we shall be looking to how the government is going to roll out this community health worker training using these methods. Because, as I say, that really is the way to go. So once again, thank you, and thank you, Jay Powell, for asking me to come. Thank you.